together?
You.
I think I met you somewhere. I represent ARP.
Right.
We have these questions from members. Everyone should have access to affordable health care when they need it, but they don't. People who do not have access to group coverage through the employer often cannot buy coverage at any price or are offered coverage only at unaffordable rates. This particularly impacts older people who are most likely to have medical history health insurers want to avoid. Question: how do you propose to ensure everyone has access to reasonably priced health coverage?
Well, I'm very happy you asked the question because, as I said earlier, one of the things that we're working on is healthcare reform. Because as I said, we have a broken system. There's no two ways about it. We have great hospitals, we have great technology, we have terrific doctors, the best brains in the world. But our system itself totally fails the people. We have 6.5 million people that are uninsured, and this is why it is very important for us to recognize that it is unfair to those that are insured right now to go and really take care of the uninsured. Because every one of you, as Kim Bilshay, my Secretary of Health, has said earlier, it's a hidden tax. The private sector right now is paying $14.7 billion in that hidden tax. And at the same time, because people don't have coverage, because it's too expensive and insurance companies don't cover them, you have overcrowded emergency rooms. Everyone is covered. And number two, that the insurance companies, because now you create a bigger risk pool, now the insurance companies have to be forced that they can never ever turn away anybody because of age or because of some medical history that they have. Because the kind of stories that I've heard in this last year since I've been working on this healthcare reform, I mean, it is unbelievable that people have been turned away. There's one family from the Central Valley, their two children are having to take medication for asthma. Now, they happen to live in Central Valley where it's very polluted. It's not their fault. But because they take asthma medication, they can't get healthcare insurance. So, I mean, they have the money, they want to get insurance, but they can't get it because the two children take medication. So those are the kind of system. This is the greatest place in the world. It's the sixth largest economy. Why would we have, for decades and decades, that kind of a mess? But those are the things that I said. They were all kind of pushed under the rug for decades. And I'm taking this all out, those kind of big problems, and solving those problems. Okay?